Welcome to my evidence-based project, part 5. I wanted to start off with a few facts that piqued my interest in my literature review. Because of the concern for patient safety, in 2004, the Institute of Medicine reported that they recommended work hours for nurses be limited to 60 hours or less in a 7-day period and no more than 12 hours in a 24-hour period. Currently, we practice 12-hour shifts with 3 days on and 4 days off, or 8-hour shifts with 5 days on and 2 days off. I found it interesting that the CDC said there was a 9% increase in the relative risk of needle stick injuries for nurses working during 12-hour periods versus the ones that are working the 8-hour periods. With that being said, I'm a little concerned. Personally, I would like to be one of those nurses that is likely going to be working a 12-hour shift. It's interesting because also in my personal experience on the GI/GU unit for clinical, all of the nurses there were working 12-hour shifts. You could see that this was taking a toll on them mentally, physically, and emotionally. There's no doubt that the fatigue creates a dangerous environment for both the nursing staff and patients. Since there are more errors during fatigue, I have a question. Could this be related to the shift hours? According to the CDC, shift work and long hours increase health and safety risks, which could result in reduced productivity and an increase in nursing error. This raises concern for both safety and risk management while we're on the floor for the hospital or the institution that we are working for. It's also concerning to me considering it's estimated that the demand for nurses will increase by 15% in 2006. To ensure the health and safety of both our patients and nurses, we must identify key factors that influence error, while also testing for possible solutions. This brings me to my question. In the ICU setting, do 8-hour nursing shifts in comparison to 12-hour nursing shifts decrease nursing error? I would like to identify my population as being ICU nurses, intervention being 12-hour shifts in comparison to those working 8-hour shifts, and the outcome hopefully being a decrease in nursing error. Now begins the fun part, research. I used filters on different website hubs to go ahead and find my information. I mostly used Cumulated Index to Nursing and Allied Health Literature, which we also know as CINAHL. I used Google Scholar and National Center for Biotechnology Information, also known as NCBI. Some of these filters that I used on these websites consisted of research articles or clinical practice, while also setting a time frame for my date. I wanted to look for articles and research that was done between 2016 and the present year. Now, I won't say it was easy. I did end up falling into a rabbit hole of looking at a certain article and then going down to their references to see who they cited and if it would be relevant to my research. So I would look at their article and then look at their references and then look at their article and then look at their references. Eventually I hit a breaking point and keywords really saved me here. Keywords like fatigue management, nurse fatigue and burnout, errors, nurse patient safety, and effects of 12-hour shifts were all really great for my research. I ultimately found 5 articles to support my PICO. The first article was testing the effects of shift length in relation to patient safety and provider outcome. This research was done in Wales at an ICU where they did test over 2 years the different factors such as clinical incidence, burnout rates, sick rates, personal injury, and training in relation to the patient safety and provider outcome. So 1 year they were testing 8-hour shifts, and then the second year was 12-hour shifts. And through the event sampling that they conducted, they were able to conclude that there were moderate levels of burnout experienced over the 2-year periods. Similarly, my next article also tested the effects of long shifts and work weeks. Through empirical data, they were able to conclude that nurse fatigue doubled during their studies, and there was an increase in burnout rates of up to 6 times the usual amount than those of shorter shifts. This ultimately had an impact on the medical errors related to the patients, which increased by 150%. My next article was testing the impact of nurse fatigue on ICU nurses that work 12-hour shifts. So it was focusing only on the 12-hour shifts rather than comparing the 8-hour shifts. This was conducted in 2 different hospitals, but both were done in an ICU setting for that 12-hour shift. These researchers used cross-sectional survey and many analysis systems to confirm their data. One of the systems that they used was Occupational Fatigue Exhaustion Recovery Scale. They were able to conclude that working 12-hour shifts had a low to moderate fatigue impact on their nurses. The fourth article tested interventions specifically for those working 12-hour shifts at night, since they've already seen in their research that there was a dissatisfaction and a decrease in productivity for those nurses. They were able to conclude actions that should be taken by those who are actually in charge to better the quality of their shift. My last article was looking at the satisfaction levels rather than the burnout in an 8-hour shift in comparison to those of a 12-hour shift in an ICU setting. This one was done in 2 phases. They sampled nurses' feelings with a questionnaire and assessed them over a year for the 8-hour test versus the 12-hour test. Now, when I say test, I do mean over the year period of that shift being tested. This research was interesting because it yielded a large proportion of the nurses were satisfied with the schedule when they were introduced to the 12-hour shift. Most of them actually thought that 12-hour shifts would benefit health while also reducing sick leave and family leave. Now, I'm not sure if you remember my actual question, but I wanted to know, in the ICU setting, do 8-hour nursing shifts in comparison to 12-hour nursing shifts decrease nursing error? Basically, my goal was to find research in support of my question, noting the comparison of shift length and error. Unfortunately, I was not able to answer my question. However, I was able to conclude from my research that regardless of shift length, there is a relation between burnout and self-care. I do think that this relationship needs to be further researched, especially when you look at the 5th provision of the Code of Ethics that states that the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. Researchers cannot focus solely on the effects of the shift length in an ICU setting, but they need to focus on the factors affecting the nurse directly, with the shift length being a secondary factor related to the safety of them and their clients. Luckily, my research wasn't completely a waste of time. I was able to find some suggestions for further research as well as limitations identified in the research I reviewed so that we could basically have a better understanding in the future. The suggestions are actually from these articles that I read. From TCA, they recommended that you create a stable schedule, you adhere to rest days, create somebody during the nighttime replacement pool to take over for 12-hour shifts when somebody is tired, improve handoff procedure, and actually implement naps and breaks during the shift. These are all suggestions that the researchers made to avoid risking negative impact on their nurses. Yu and King were actually able to identify different factors that they say affected the burnout rate in the shift change. They identified age, number of family dependents, year of experience, and experience or exercise frequency. All of these impact the nurse on their fatigue levels after a longer shift. As for the limitations, in our first study, they were measuring shift length related to patient safety and provider outcome. I do think that since they had a low response rate in their burnout section of the questionnaire, they could improve their results by identifying different demographics related to those who are participating in the study so that they could identify factors of why these response rates might be so low, or use better data analysis systems to yield accurate results. Similarly, in the TCA study, I think that there are demographics that we could identify to improve the results. We could have the subjects fill out demographic portions of the questionnaire identifying their tenure, employment type, and then really account for those who left during the study that could affect the research. Well, thank you for joining my evidence-based project, part 5. Below are the references that I used during this study to support the information that I brought to you. Thank you.